What are you doing to address the issue of understaffing now in aged care homes? We're getting reports that some residents aren't being showered or changed for more than 3 days or being left in soiled beds for up to 24 hours. Clearly staffing's an issue, so what are you doing to address?
Well, again, those staffing matters are principally a matter for the federal government and the people who run those aged care facilities. If we can assist in that, we certainly will. I've not had those reports, Lundy, but again, we will do whatever we can to support this sector, which is run by private companies or by churches, charitable groups, but it's regulated, it's funded, it is controlled by the Commonwealth Government, and that's why we're working so closely with them. And again, I want to thank them for the partnership.
Should the Royal Commission into Aged Care start looking at these issues as part of the agreement?
I would not seek to guide that process. That's entirely a matter for them. And to be honest, my focus is absolutely exclusively on trying to deal with the challenges that this setting and in every other setting throws up at us. I would just say, in terms of working in multiple sites, this is the point I made off the top. No one, regardless of the job you do or where you do it, should be going to work if you've got even the mildest of symptoms. You should go and get tested. That's what I'd ask you to do. That is my request of you. And if we need to support you in that, we will absolutely provide that financial support if that's the driving factor for you to continue to go and work and come into contact with many people and potentially spread the virus amongst those that you come in contact with, people you work with, customers, patients, clients, people that you spend time with going to and from work. That's my request, that's our request, and we'll be not only grateful, but we will be out of this sooner if everyone who's got symptoms does not present to work but instead goes and gets tested and waits at home until they get the results of that test.
How can families have confidence in the aged care system? We've heard so much about training and PPE supply. Clearly, though, with this many cases, it is absolutely not working.
Well, we know that if this gets into aged care settings, then that does present a very significant challenge. I know that the Federal Minister has been speaking with families directly overnight, and I think that's a very important thing to try and provide some of the information and clarity that some families had not been able to get. I know that would be a terribly difficult circumstance to find yourself in. The key point here is we're all working very carefully. It's not a matter of who's responsible for this sector and who isn't. That isn't the issue. Well, what I'm saying,
deeply distressed about this situation.
There's no doubting that. The second point you make, as for things working and not working, we are working as hard as we possibly can with the Commonwealth Government. That's an important thing. No one's doing turf wars or anything here. We are working together really closely to get those masks out to everyone who needs one, all the other gowns and gloves. We are working as hard as we can to take people out of aged care where that's the clinically appropriate thing and put them into a Victorian government-run hospital or a private hospital to make sure that they're getting that high degree of care that they may need. This is a very, very challenging set of circumstances, and we know that the consequences could not be more grave. If it gets into aged care, then we know people will die. We have a problem at the moment. Everyone's working together as best they possibly can to deal with that. I know that will not make the very, very difficult circumstances that families are enduring any easier, but I would hope they took some comfort from the fact that there's nothing but a cooperative approach and a shared effort here to try and bring this under some sort of control.
Mandated nurse-to-resident ratios in state-run nursing homes. My understanding is that we don't in the private and not-for-profit sectors. Do you think that's one of the reasons that the vast majority of the nursing home cases we're seeing are in those sectors?
Rachel, can I make a point to you that I've been around these areas of policy for almost my entire working life in one way or another, and I can give you a very long description of the differences between public sector aged care, and we are the state with the greatest amount of public sector aged care. Others got out of that space. We've stayed in it. We're very proud to have done that. But me running a commentary on these matters, I think, will only inflame things and only shift our focus from where it should be. Rich asked me a question about other processes that are going on. I don't want to get into that, nor do I want to get into what will essentially be read as a criticism of that part of the aged care system that we don't run. Doesn't matter who runs it. We've got a big problem, and we've got to work together to fix it, and that's exactly what everybody's doing.
Do you agree that most of the cases are in the private sector?
That's not a matter of agreement or disagreement. That's a matter of fact. But again, please, no one should read into that. That is not a commentary. That is simply a matter of fact. But ultimately, if you're a family that's got a grandparent or a great-grandparent in a facility where there's been an outbreak, you don't much care who runs it. You don't much care whether it's a public sector or private sector, a church or charitable or a for-profit. What you want is your loved one taken care of, and what I'm saying to every single Victorian is we're doing everything we possibly can and working with the people who actually run this sector, so private providers and the Commonwealth Government. We are unified in that work, and we need to be. But again, it gets back to that central point, and if there's one thing that you guys put in your bulletins tonight, in your columns tomorrow, in all the work that you do, my plea, my appeal, my request, and our requirement is that no one go to work if they have symptoms. Any workplace at all. You've got to go and get tested, and then you have to wait at home until you get the results of that test.
You said 90% of people were not getting tested after developing the first symptom. 50% weren't waiting at home between testing and getting their results.
89% and 53%, I think, were the numbers.
Yeah.
I haven't got an update on that, Samay, but if I can get you one, and we will be able to once we get looking back from those interviews. Basically, where that data comes from is when you do the long form interviews. If I can provide it. Not if, I will be able to provide an update a bit later on this week.
Last week you said 1,200 people had made an application for the $1,500 hardship payment.
Something like that, yes.
The department later confirmed that only 182 people have received the money. Do you have the latest figures? And do you think it's good enough that people are waiting weeks to be able to access the $1,500?
No, and that's why I've asked for that to be streamlined. That's why I've asked for any and all resources that need to be deployed to get those payments made as quickly as possible. I think that we can't let perfect be the enemy of the good. We can't let that be the enemy of getting those payments made quickly. And I think that whilst we never encourage people to be claiming things they're not actually entitled to, I'm very keen to get that money out as fast as we possibly can, because the benefits will far outweigh any minor issues that we might have. When I'm in a position, as I think I alluded to from an earlier question, if I can, when I can later in the week, give you an update about the $300 payment and the $1,500 payment, I'll be more than happy to do that.
Randy, the Colac Highway there is called for stage 3 restrictions in his area due to the breakout of his
Sure.
Is that something you consider adding that to the council area?
We've got no advice to that effect. If we did have advice to that end, then that's exactly what we would do. The people of Colac are strong. The people of Colac have done a great job. I know there's been a bit of reporting about advice that changes. Well, if you're an asymptomatic test, then you get one set of advice. That makes perfect sense. If you're then later deemed to be a close contact, that advice changes. This is wildly infectious, and advice to people, circumstances of people, it does change. And I know that's really challenging. It's really hard. People are very keen to have one set of advice. Just tell me what to do and I'll do it. If that's how this virus unfolded, well, then it would be half the challenge that it is. Things do change rapidly, and that's why you try to provide the very best advice in real time. And the team that's worked with that particular outbreak, the team that's now 2,300 plus many more playing support roles, they're all, I can tell you, because I speak with a lot of them, I get reports on all of them one way or the other. They are all working as hard as they possibly can. And I suppose in thanking those who are doing the right thing, and in thanking our staff, it's a massive team, I'd ask every other Victorian to join me in thanking them. And one of the things you can do is don't go to work if you're sick. That's better for you, for your family, for your workmates. It's better for every single family. And it's a profound way in which we can all say thank you to those who, instead of being on the front line, they are the last line of defence. We've got to assume and accept and embrace the responsibility that we have, and that is to do the right thing. And that never includes, ever, going to work when you've got symptoms, even if they're mild.
In terms of Colac, there are some reports that some residents in that area are waiting to up to 7 days for test results. Is that what you've heard? Is that acceptable?
I haven't heard that report, but I'm happy to follow that up. Obviously, laboratory capacity is not an infinite thing. We're pushing the limits, and we're getting some support from other states. We're getting support from the private sector, and I want to give them a shout out for the way that they've joined that team. Many of us will never meet someone who works in one of these infectious diseases reference laboratories or one of these private pathology services, but at the risk of others in the team not being happy that they didn't get a shout out, I want to give one to all those people that are working, taking tests and processing tests. It's critically important, and they're doing a fantastic job. They're doing their best, and if you were doing but a fraction of the numbers, then you'd get the results quicker. But at the volume, I think, drives some of those delays. So I'm happy to follow up on the individual case you mentioned, Rich.
We need to tighten up the rules or change the rules in workplaces, especially in places like abattoirs, so that if there is one case, the response is much more vast and quicker, so that perhaps everybody is treated as a close contact.
Yeah, I think that those 150 additional inspections, those on-site inspections, and there are again, I'm not fully briefed on exactly what this involves, but there's about 300 virtual inspections as well. So I think where they might interview and have management talk them through all the different processes, and if there's any deficiencies here, they then go out. They're obviously trying to limit their movement as well, so they're not spreading this. But there's a power of work going into that at the moment, even in the last week, since we made some announcements about a real blitz in terms of some of those high-risk workplaces. If there's more that we can do, then we'll have further announcements to make. We have a few other options, not necessarily along the lines that you've suggested, but I think there are some other things that we can do, and we may have more to say about that later on in the week.
We still have a large number of workplace transmission or people going into work while they're sick.
Yes.
Particularly over the past week or two, have people sort of outlined to contact tracers or to the department why they're going to work while they're infected or waiting for test results?
Yeah, that's a really important piece of work. We have got people doing, it's not so much data management as it is, or a data thing. It's not a quantitative thing. It's more trying to have a qualitative sense, so that to understand, as you point out in your question, what's driving this. We know from some of that analysis, financial hardship or the prospect of not working shifts and therefore not getting paid, that's one factor. We're still working very hard, not just crunching numbers, but also having a look at some of the details that are provided to us through those very long first off interviews to try and better understand patterns, to better understand what's driving that. If I've got more to update you on, I will.
What should there be other factors? You mentioned finance was one.
Well, I think that the one obvious one is finance. I think beyond that, it does get quite difficult to necessarily have people describing their emotional state. We're much more concerned about getting the facts, I suppose, just so we can then contact trace and try and limit the spread of that particular chain. But we're trying to do a bit more work, and in some respects go back and have a conversation looking back to those who are not on the board, as it were, now. They're not active cases now, but they were. That's a separate piece of work, and again, part of the challenge here is trying to task and allocate and not have a project like that, which is very important but can take some time, take resources away from the immediate challenge.
I know you said you're pushing the limits in terms of what the labs...
No, that's right, Lundy.
Pushing the limits in terms of what the labs can do. Is that putting stress on the DHHS as well in terms of letting people know what the results are? We've had at least one case where a person's been told they're inconclusive, negative, positive, and then negative in the same week.
There are very... well, the point I'm making, though, I'm not foreshadowing that people in our labs are doing anything other than their absolute best and delivering in global terms quick turnaround, as quick as you can expect given the volume. The point I'm making beyond that is we don't have capacity to do 100,000 tests a day. There are limits, and if you look at our average over the last 3 to 4 weeks, it's certainly higher than 25,000. I think I haven't looked at it in the last couple of days, but it's a very significant amount of testing. We're grateful to everyone coming forward and getting tested. We want to say thank you to those who are running that program, those who are working in labs literally 24/7. We do have additional capacity. We can do more than we are now, but that will just push out the time a little bit. So you just got to get that balance right. We think we're doing enough testing to find positive cases. We're doing enough testing to have a good sense of where the virus is, but it's a big and complex system. We've done My notes tell me we have done more than 1.5 million tests. In fact, we have done a total of 1,518,107 tests. So that just gives you a sense of how big a challenge that is. That's since January 1. That is one of the highest testing rates in the world, up over 1 in 5. Victorians have been tested. That's a massive task. I believe so. They'll always. Yeah, well, I'm not aware of the specifics of that case. There'll always be. None of these tests are 100%. There'll always be a small number where. We've seen some very well publicised cases of people that have tested negative and then later tested positive. We've seen people who have tested positive and then tested again weeks and weeks and weeks later. Whether their infectivity level may have been but a fraction, they may not have been a risk to public health. But in any system as big as that, more than 1.5 million tests, there'll always be some that you can't quite explain. There'll be outliers. There'll be challenges. It's a big system, a very big system, and literally thousands of people are doing their very, very best.
Brett, do you have any stability?
Why don't we let Bridget go first, and then, unless she's got one for Brett.
Should there be a short-term shutdown of networks across the state to prevent more outbreaks, particularly in regional areas?
That's not the advice that I have at the moment. But if we were to continue to see outbreaks, if we were to continue to see people quite obviously attending work when they shouldn't be, then every option becomes on the table. And that's not the position at the moment. And I'm very grateful to those employers. And they're not the only high-risk site. We shouldn't single them out to the exclusion of others. It's not just cool stores, meat works, abattoirs, whatever you want to term them. It's not just big warehouses, distribution, freight, logistics centres. There's lots of different sites, aged care, healthcare, the list goes on. But there, next steps may well have to include closing a number of these industries if we continue to see people attending work. So the reason I make that point, because it's no different to what's being said with those some 200 inspections that have been conducted over the last week or so by WorkSafe staff. That's what employers are being told. So employers have got business owners have got a really big stake in this also. We all have to work together to keep anyone who's got symptoms away from work. Otherwise, businesses will have to close. And the thing is this, when you have an outbreak, that business will shut. They'll be the subject of deep cleaning. They'll be the subject of literally hundreds and thousands of hours of public health team work, contact tracing, testing, all of that. There's an economic cost to that. There's a very significant public health cost also. So that work is not just me standing here asking people to do it. It's got to be enterprise by enterprise, workplace by workplace. And I'm really confident that they are stepping up to do that work with us because they need to. Someone had something with Brett, did they?
Yeah.
No?
I was Brett, is there any stability outside of increases in aged care, healthcare and networks distribution centres in the numbers?
There is some stability. We've seen some postcodes where there has either been plateauing or a decrease in daily numbers. North Melbourne and Flemington are a case in point, and that really relates to the intensive management of those cases in the towers. And speaks to the fact that if you can support people to get tested, support them in their isolation and quarantine, then you can drive down numbers across entire postcodes. So that's what's happened there. There are a number of other postcodes where we are absolutely seeing numbers plateau. There are some others where it's ticked up in the last few days. Brimbank, Greater Dandenong are both examples. We're looking into what might be driving that, but again, sometimes it's related to those aged care or other work settings where outbreaks occur, or the spillover from those outbreaks where the close contacts in the household then become cases. So we're always looking into where we're seeing trends going in the right direction or the wrong direction so that we can understand it better, so we know what our policy responses need to be. I am. I mean, every country in the world, essentially, apart from a few notable ones, get on top of it. You do need to keep looking into what you have to do. and it can take longer in some settings. It can take longer in a second wave. That certainly seems to be the case internationally. But you get to the other side, and we will get to the other side. Again, modelling with our effective reproduction number that I've seen most recently suggests that today should be the peak. Now, I'm not going to sit back and say today's the peak. We have to see what happens in coming days. But driving that effective reproduction number down below 1 is the thing that will start to see numbers drop. And as numbers drop, outbreaks drop. At the moment, I'm more concerned that we'll probably see a rise in numbers because the outbreaks are really volatile. In aged care settings, the numbers can increase very significantly in a very short period of time, even as community transmission might be coming down. It's encouraging to see that effective reproduction number come to 1 or just below 1, but we have to keep at it every day.
So what would you say to people who get really alarmed because the numbers keep going up and the numbers of deaths keep going up?
Alarm's okay. If that motivates you to do the right thing, please consider what the consequences are of our increase in daily numbers. It is causing an increase in hospitalisation of scores of people, another couple of people in ICU, still relatively low numbers in terms of ICU and what our capacity is. But the consequences of daily numbers that we're seeing are lots of people who are very unwell, and we've seen the ads, we've seen people's stories about what a devastating illness it can be for them, and how many weeks and months it takes for them to recover, and others who die. And so that should be alarming to all of us, and it should be something that we keep in our minds in terms of how we think about going about our daily lives, how we follow the rules. And even with that very mild symptom that you might dismiss, I think this is part of the factor of people coming to work. It's just a runny nose. It's just a tickle at the back of the throat. I've got a headache and some lethargy.
But do you worry that people listen less or follow the restrictions less to the thing, oh, well, lockdown's been going 3 weeks, doesn't matter anyway? I mean, you see commentary like that on social media. Do you worry that the ever-increasing number actually has a perverse response and people go, it's not worth following the rules?
I'm not sure if people are losing motivation. I think most people are becoming increasingly concerned by the numbers. There's a small minority who I think we can just let be, who are trying to whip up the idea that this is overblown or fear-mongering. You won't see fear-mongering in the consequences in aged care. You will see the deadly consequences of infection, and people just need to recognise that these are all members of people's families across Melbourne and beyond.
Just on aged care, I think Gardens had a massive jump in just a day. I think it went from 1 to 77, I think was your number.
Yeah, obviously.
Such a big increase.
Well, whenever we get a case in aged care, outbreak squads go out, the testing squads go out, they test everyone, staff and residents, and when all of those results come back, we can get suddenly a massive indication of how many people are infected. There might be several of those who are asymptomatic because we picked it up very early, but it is an indication of the fact that it was spreading there for some time, and that there were cases that have gone undetected that have now been picked up as we've responded to that very first case.
Do you think we have over 4,000 active cases, and I think it's about 200 people in hospital, around 40 in ICU? What do those numbers tell us?
4,000 active cases is a huge challenge. We know that people need to isolate, and that those 4,000 cases represent at least as many close contacts. There aren't as many close contacts for each case now because people are staying home. It's a great indication. But the hospital numbers will increase based on the numbers that we're seeing today. Those individuals from today will be hospitalised in the next fortnight. So there will be challenges for hospital admissions, and there will be increasing challenges for those who require ICU.
I meant in terms of, I guess, the proportionality of the number of ICU patients and hospital patients to the number of active cases. It doesn't sound like a lot. So I just wanted to...
Yeah, I think there's a lag. I think we'll see an increase in ICU cases in the next couple of weeks that'll be more reflective of our total active cases. But really the uptick in cases has just been significant in the last couple of weeks, and it's yet to play out in terms of those who require ICU, those who require ventilation.
Do we need to change our approach to testing staff at aged care homes? We've had some reports of a positive test in one aged care home, and other staff in that home going to get themselves tested even though they were asymptomatic and being told they couldn't be tested because they didn't have symptoms. Is that the right strategy?
We always respond with testing when there's a positive case in aged care. So all of those staff will be tested regardless of symptoms. That's our standard outbreak response. So that's what should be happening.
It doesn't sound like it is though. The report I've read it.
Well, I'm not sure of that report. If there are individuals who are going to a testing site without having responded to the outbreak team, they might be turning up and saying, I'm asymptomatic and not identifying themselves as a close contact in an aged care facility. We would say all close contacts get tested, and we support the testing for all staff and residents in those aged care settings.
And so is the definition of a close contact if you work in an aged care facility, the fact that you work in that aged care facility?
And there's one case there, yeah.
Just on Colac, do you think that change in advice contributed to the spread there?
No, I think the spread had occurred. I think the fact that we see any of those close contacts come up as positive makes everyone a close contact across that facility. That's what the change in response, I guess, in abattoirs are. That if we see any transmission within a facility, we include all 700, 1,200, whatever the number might be, of staff as close contacts and require them to quarantine. So that's the changed approach, I guess, to be as precautionary as possible in abattoirs.
So it was just brought in last week, was it, that change in approach? It was just brought in last week?
No, it wasn't just brought in last week. It's been in place really since CEDA meets in terms of how we...
So why was the completely advice issued in the first place that if you're asymptomatic you didn't have to isolate?
So the immediate close contacts of the first case get tested. If there's any evidence of transmission within that facility, everyone's a close contact.
We've got 3 or 4 clusters in abattoirs. We've got another 3 or 4 in small goods manufacturers. Do we know if there are any links between those clusters?
Some of them we are aware of links, and sometimes it's because there are family members who work in both of those settings, and so that's the linkage. So we are aware of some of those.
Able to analyse the genomics of the outbreaks at aged care facilities?
They'll be in process. I haven't seen them specifically for aged care.
Sorry, go ahead. The Premier yesterday said that it's not feasible to move all aged care residents into hospitals if they don't need to be hospitalised. But given the serious outbreaks we're having, is there room to? Or would you potentially consider moving all aged care residents to hospitals?
I don't think it'll be feasible to move all aged care residents into hospitals, and I don't think it'll be the safest thing for that to occur. There'll be circumstances where residents are best looked after right where they are. That's often especially the case for dementia affected residents. And the familiarity of those who care for them normally is a really critical point. And I think we'll look to ensure that families can have a role while ensuring that they can remain safe from coronavirus infection as well, because they play a critical safety element in managing those residents. But it's not always the case that transfer to an acute care setting is either wanted by the residents or their families, or is safer or more appropriate. But we'll do it as is required. It's always a conversation between Commonwealth and State, the facility and the acute care setting.
Is the contact tracing database, or is it a centralised digital database that's updated in real time?
It's a centralised database, our contact tracing database. There are some elements that happen on paper if they're farmed out to other settings, but overwhelmingly it's done online in real time.
Are you concerned that the contact tracing is working given current numbers and how difficult a challenge that is now? And does there need to be more support?
So there are big numbers certainly every day, but all of those are allocated on a daily basis to contact tracers. We've had bottlenecks in recent weeks, but at the moment, even with 400 or 500 cases a day, all of those get allocated. All of those individuals who pick up the phone will be interviewed, and all of the close contacts identified and notified within 24 hours. So it's working very well at the moment, and we're within capacity. We could do 600, 700, 800 interviews a day. I hope we don't have to go there, but we could if we needed to.
And has the ADF door knocking made any difference?
It has. The ADF are doing great door knocking. What they're recognising is that Some people aren't home. We need to follow up as to why any case might not be at home. Sometimes that means they might have isolated elsewhere, but we need to check that they're being compliant. But they're also identifying people who are ready to do the interview, and we're working on having that interview done on the doorstep for people who haven't picked up the phone or haven't completed their interview to date.
I mean, what lessons did you learn from 2009 global pandemic that helped us prepare for this?
Well, Rich, I'll take you right back to the Royal Melbourne Hospital all those months ago now, where we stood up and talked about in a brand new commissioned space that had not a month earlier been an ICU, but it now is. And we talked about some of the impacts, and we released our full pandemic plan. That pandemic plan, there's no question, was absolutely informed by other bird flu, swine flu, all those challenges from quite a few years ago now. But this, I'm not for a moment speaking against the notion of all that sort of continuous improvement, and I think that has been a feature of things. But this is a 1 in 100 year event, and the point's been made by many people many times that there's no handbook for this. There isn't. It is unique in many ways. The second wave challenges, though, as Brett indicated, with a couple of exceptions who've not been able to get on top of their second wave, most around the world have found it more challenging, but they've got there. And that's why I think it's so important today to thank those who are doing the right thing. That is the vast majority. I'm not so interested in focusing on people. I'm not criticising some of the coverage. It is quite newsworthy, some of the amazing behaviour that some people are exhibiting, but let's not have that detract from people who are doing the right thing. And I'd say to each of you and to your news directors and others, let's not have those sorts of stories detract from what is the central message. If you have symptoms, you cannot go to work. You can only do one thing, and that is go and get tested. And it doesn't matter what job you do, what workplace, what industry you work in, anyone. If you've got symptoms, you've got to come forward and get tested. You cannot go to work. That's my request of you. That's what's required in order for us to get to the other side of this and see these numbers come down rather than continue to go up.
I was just going to ask about the health from interstate. I know that there's some people in New South Wales doing contact
There
tracing.
is.
What's the extent of that, and is there any need in the future, do you think, to get interstate healthcare workers, nurses, for instance, down at Victoria Health Hub?
Look, we've got some. We've had AMBOs from South Australia. We've had public health experts from all over the country. I was communicating with Premier McGowan on the weekend about some extra contact tracing that they think they've got some capacity to do. I think that's being actioned today. There are so many offers of assistance and so many different tasks that have been allocated. It's probably best I don't try and do a list from memory. I'm happy to come back to you though, and we're deeply grateful. Just as we are, can I say, ADF have always been here. Their numbers have grown substantially in recent weeks. The private sector's always been a feature of this, whether it be staff from various travel agencies who got stood down at the beginning of the first wave have been part of our call taking and call making team. The Health Direct Medibank private staff that have joined the team, not quite sure of the exact number, it's certainly triple figures. They're doing an amazing job just ploughing through detailed interviews each and every day. It's a big team effort. It's a big team. As I've said a few times, I can't rule out that it gets bigger still because the challenge continues to grow. But Interstate's doing an enormous amount of work for us. If I can get some more details on that, I'm more than happy to do that.
Do you envisage that we will need to get, say, nurses or people from interstate? Are we okay with that database as well?
Well, I think we have very significant numbers of people that have put their hand up to come back to work, those who might be retired, those who might have moved into a different industry, those who maybe had taken a break from clinical care to go and study, for instance. What I'd say is if we need it, we will absolutely get it from wherever we have to get it, whether it's the private sector, the public sector, Victoria, the Commonwealth, other states. Well, we've always said yes when there's been additional support, and it's a really important thing. And it's no different in many respects. You talk about learnings, not just from previous pandemics, but every summer we get through something as challenging as this.
And that's
every
where we
summer.
farewell viewers on the main ABC channel in WA. If you want to continue watching this, you can do so on the ABC News channel.
Season every year. We share, we cooperate, we partner. We see ourselves as a nation, not just as a set of individual states and territories. That approach works every summer, and it's very much at play now.
Speaking of workplaces, Parliament's due to sit Tuesday.
Yes.
Going ahead.
I've got no advice to the contrary. How that looks, though, how it's structured, the number of people that'll be there, the not insignificant challenge of having regional MPs that are outside that lockdown area coming into Melbourne, all of those things will need to be the subject of public health advice and some discussions between the public health team and the President and Speaker.
Who's in charge of coordinating all the different teams with contact tracing? Is there a specific minister who brings it all together? Or?
No, it's not at a ministerial level. There'll be reports and ultimate accountability at that level, but in terms of the day-to-day decisions, there's a team of people that are very highly skilled, and it ranges from public health physicians, people who are expert in these matters, all the way through to others. I'll give you an example. Someone who's well known to many people, Professor Ewan Wallace, who is the head of Safer Care Victoria. He's now playing an active role, has done for a few weeks now, an active role in some of that work. Former head of obstetrics out at Monash Health. There's lots of different people are involved, and it's at every point it's trying to use the best skills for the best purpose. And there are a lot of people working in areas they would not probably have thought they would be working in, but their skills work. The other thing that the ADF do that is really important and has been a feature for the best part of 6 months now, different challenge at the beginning of the year, but certainly at play all the way through the year, that teaming and tasking, so working out how best to build systems and allocate teams so that everyone's got work to do and that everyone's as absolutely efficient as they can be. The ADF are invaluable with that.
There's been a number of posts on social media, I'm assuming a conspiracy theorist, but maybe you'd like to debunk them publicly, that the Victorian government is paying for the funerals of people who died with COVID.
The thing with conspiracy theorists is that the more you engage in an argument with them, the more oxygen you're giving them, the more ultimately, I think people can judge for themselves the efficacy, the credibility of people who are running those sorts of keyboard warrior campaigns. Seriously. One more comment about human rights. Honestly, it's about human life. And if we continue with this stuff, standing in the car park at Bunnings reading whatever nonsense you've pulled up from some obscure website. But having said that, now that'll run in your newses tonight. That was not what I was wanting to achieve. Today's message, and the message that will be the most powerful and the most impactful, the message that will save lives, is not focusing on people who, frankly, their behaviour is appalling. Their views have no basis in science or fact or law. Don't focus on them. What we should be focusing on is appealing to every single worker. Don't go to work if you've got symptoms. You've lured me into making some comments, but it is frustrating. And again, perhaps I apologise for letting my frustration get the better of me. But ultimately, this is not about those issues, and it's not about those people, frankly. It's about not diminishing our gratitude for the vast majority of Victorians who are doing a fantastic job, and it's also about not taking away from what should be and what really must be the central message, and that is, if you're sick, stay home, then get tested, and then wait for your results at home. The only thing to do when you get sick, even mild symptoms, is to get tested, not to go to work as if you were not sick, because all that does is spread this virus.
Would you consider adding Luke Miller and your Minister for Ageing into your crisis council cabinet given?
This is a coordinating body. There's a cabinet meeting today, for instance. There's regular and routine discussions. Minister Ellen and I talk. Minister Makakos and Minister Ellen talk. They talk with Minister Colbeck and Minister Hunt. There's cabinet committees are not so much the issue here. nor is working the effective partnership between governments. People are working very closely together because we all know that this is not a matter of turf war or the kind of tribalism. It's about a big challenge, and it's a little more complex, but not. It's not impacting the way in which we tackle the challenge. But this is a sector that it's not straightforward. Our aged care is ours, theirs is run by them. Then we've got the church and charitable sector, the for-profit sector, but we're all working together because the challenge and the virus does not discriminate based on who owns or who runs the aged care facility where your loved one is a resident.
Just on schools, we've got, I think, 44 schools closed now. Are you worried that, particularly for VCE students, I know this is a personal interest to you as well, but they're pretty worried right now that their year has been pretty heavily disrupted. Are they going to be at a disadvantage this year?
Well, there's no doubt that this is a year 11 and 12, and given that you raised the personal issues in my household, there's no doubt that this is a very different year 12 than we've ever seen. We have processes in place in terms of trying to take some of those special and unique circumstances into account when we're trying to mark people and give them their ranking. Their score is ultimately a ranking and where they sit within the overall cohort. I just say to Year 12 students, everyone's doing a different Year 12. Everyone has been disrupted and impacted by this, but you've got the best teachers anywhere in the world. Their support staff are second to none. Families are supporting you. The system is supporting you as best as it possibly can. And in my conversations with CEOs of TAFE colleges, big employers, as well as vice-chancellors at universities, they're all confident that we can get this group through, get them the scores, and then get them the jobs and the training and the pathway that they're all fundamentally entitled to. Ultimately, your studies should be your focus, and you'll be supported, and ultimately you'll look back for a long time, not concerned that you missed opportunities, but I suppose you'll just look back and reflect that this was a Year 12 unlike any other. Everyone's working very hard to make sure that you get your score, and you will get your score this year. And as I said, I talk to big builders, big employers. They don't see this as a challenge. They're going to be hiring next year. I talk to CEOs at TAFEs. They're going to be enrolling students probably more than they ever have, and on better terms, trying to deal with some of the skills shortages that have to be dealt with when you've got a prolonged period of higher than expected unemployment. And in talking to university vice-chancellors across the board, they're very confident that they'll get the scores, they'll get the rankings that they need to admit students, and they'll work very hard with them in first year as they do every first year, so that everybody is exactly where they need to be as they move into second year. That's a feature of university every year, pandemic or no pandemic.
With normal schools closing, would you consider sending VCE students home?
That's not the advice we have. The advice is that this can be done safely. We've got a real focus at the moment on getting that deep cleaning done as quickly as we possibly can, and making sure that schools can reopen as soon as possible. I suppose the alternative would, because of 44 out of the total number of schools, which is much bigger when you think about Catholic independent as well as government, that would not be a proportionate response to close them all down. The other issue too is that the alternative would be to not take seriously every time there is a positive case at a school, and of course we're always going to take those matters seriously. It's inconvenient, I know, but I think that our Year 12 students and teachers and support staff are particularly resilient. They work very hard. They did a magnificent job last time, and I'm confident they're doing their very best now. And it does make you proud to see the effort that's going into the nurturing and the education and the prospects of those that we love the most. We're all very, very grateful.
I'm going to chime in with a question. Just on VC classes, would
Yes.
you consider making them smaller groups of people, like 3 or 4 students in one classroom, and spreading them across this whole school?
I'd need to come back to you on that, Samara. I think mask wearing, which from my own household, I can tell you that Year 12s at my son's school are all now they're wearing masks. They're being very diligent when it comes to that infection control and doing everything they can to minimise. Teachers are working really hard. Like I didn't think I'd be doing Zoom parent-teacher interviews ever, but normally I don't get to them. Normally it's not something I can manage, but Everyone's doing things differently. Everyone's doing their best, and I'm deeply grateful, particularly to teachers and support staff, to students who are making the best of a very unique set of circumstances. Any other issues? Thanks very much. We'll see you tomorrow.